Hi, everyone. I'm Allyson Mullins, one of the clinical directors at Cadient.
And I'm Jesse Beasley, the speech-language pathologist at Cadient.
So today we're going to talk about collaborative intervention, improving outcomes when clinical treatment providers work together.
And today, just a little overview of this presentation. We're going to introduce ourselves. We're going to talk about what an interdisciplinary team is, who is involved, what are the benefits, and how different fields can work together and collaboratively and provide the most effective outcomes.
So just a little bit more about me. I am the clinical director of our Forsyth Clinic in Johns Creek. My master's is in science. I have a master's of science in clinical psychology, and my background has involved using collaborative and interdisciplinary teams through that. And then I've been working with individuals on the autism spectrum for 10 years and in a variety of settings, including schools and residential facilities, where I was a part of several interdisciplinary teams as well.
And a little bit about myself. I'm the speech-language pathologist at the Cadient Sandy Springs, Johns Creek, and Duluth locations. I have a master's of science in communication sciences and disorders, and I have worked in the clinic, school, and rehabilitative hospital settings. So what is an interdisciplinary team? It's a type of service model where several providers from different fields work together to provide the best care and outcome for our clients. This type of model has been used for addiction, fibromyalgia, depression, chronic pain, and in the school setting as well. And it's also being introduced into the field of autism.
So what types of teams can work together to treat individuals with autism? So certainly speech and language pathologists, they can diagnose and treat issues related to speech production, feeding and swallowing, language acquisition, and communication disorders. Psychologists or counselors can, psychologists can diagnose autism, and they can treat a variety of comorbid disorders, including anxiety, depression, ADHD, oppositional defiant disorder, which are all very common disorders, as well as having an autism diagnosis. And then they can also help the family access resources and provide support through family therapy. And then, of course, occupational therapists and physical therapists who can really address those sensory motor and adaptive living needs. Behavior analysts who can address the behavioral concerns, really work on those skill building along with the speech and language pathologists, the OTs, and the physical therapists. And then physicians and nutritionists can really address medical issues, which are also common to those with autism, including seizures, immune disorders, and gastrointestinal issues. And then nutritionists can provide help with those nutritional or dietary deficits. So just because this is my area, I'm going to tell you a little bit about applied behavior analysis for those of you that might not be familiar. So it's really the study of behavior and why we do what we do. So we look at the relationships between the behavior and then the environment. And we consider the environment to both be internal and external factors. So typically, behavior analysts, we look at the observable and measurable behavior, but we do recognize that there are internal processes like getting hungry or having a headache that can affect behavior. And so there are just other disciplines that can approach those and address those things. So we're really focusing on that, the measurable and observable behavior. And then we really try to individualize treatment based on the functions of the behavior and then the context in which the behavior occurs. So we're really looking at the why and how to really meet the client or the individual where they are. And then a lot of what we do involves skill acquisition and increasing either existing socially appropriate behaviors or really building and teaching those socially appropriate and functional behaviors while decreasing maladaptive behaviors. So something we might work on are language skills, which includes receptive language, which is like following instructions, identifying objects or pictures in an array, and then the expressive language. So being able to request for things, to label things, to engage in a conversation, and then things like social skills. So eye contact, turn taking, being able to play with toys appropriately, and to really have those leisure skills. And then things like imitation, which are appropriate and necessary to learn in order for language acquisition to occur. So that can be both gross and fine motor. So we look at those things, which goes hand in hand with occupational therapists and physical therapists. And then we look at increasing replacement behaviors. So we're not just decreasing or putting certain behaviors that are maladaptive on extinction. We're also looking at ways that we can promote an individual being able to tolerate change, tolerating waiting, tolerating no, and then being able to do things like gain attention appropriately to get their needs met.
What is speech-language pathology? You may have heard of speech-language pathologists referred to as speech therapists, a speech teacher, SLPs, but we're all the same. SLPs work with clients across the lifespan and with a variety of disorders. For example, speech, we work on speech sounds. So how well we say and put words together. Other names for this is called articulation or phonological disorders, such as apraxia of speech or dysarthria. Another thing we work on is language. So how well we understand what we hear or read and how well we can tell others what we're thinking. And with adults, this is often called aphasia. We can also work on literacy skills, so how well we read and write. People with speech and language disorders may also have trouble reading and comprehending what they read. We also work on social communication. This is known as pragmatic, so how well we follow social rules like turn taking, how we talk to different people, and how close we stay into someone when we're talking. Another thing SLPs can address is voice. So that's how our voice sounds. We may sound hoarse, we may lose our voices easily, talk too loudly, or talk through our noses. SLPs can help address these needs. We also work in an area called fluency, which is more commonly known as stuttering, and this is how well our speech flows. So someone who stutters may repeat the initial sound of a word or use or and pause a lot while they're talking. Many young children will go through a time where they will stutter, but most of the time will grow out of it. We also work on cognitive communication. So that's how well our minds work. So it involves memory, attention, problem solving, organization, and other thinking skills. We also can work on feeding and swallowing. So this is how well we suck, chew, and swallow our food and liquid. A swallowing disorder may lead to poor nutrition, weight loss, or other health problems. This is also known as dysphagia. We can also work with augmentative and alternative communication. So this is finding a way to communicate that's not necessarily verbal. So this could be sign language, this could be a picture board, or some type of voice generating device. So what is occupational therapy? It focuses on skill development across the life domain so individuals can participate in meaningful activities. So their activities of daily life. These include household tasks, hobbies, eating, and social situations. Occupational therapists work with clients to develop, recover, and improve skills required to complete the activities of daily living.
So how can all of these teams work together? Obviously, these come from a lot of different frameworks, and so Cox wrote a paper and suggests using an ethical framework and language that can help integrate these different disciplines toward a common goal. And obviously, the common goal is to address all the concerns for the individual and families and to improve outcomes. So one of the things that we can all agree that we participate in is informed consent. So this is from the very beginning of the intake process. So we're providing a clear understanding as to what the therapeutic strategies are, the rationale and prognosis of all those treatments, and the risks and benefits of any alternative treatments that are not being offered, and to ultimately let the family know that it is their choice. And this is, it starts at the intake process, but this is throughout treatment. So if at any time a family or an individual feels uncomfortable with treatment, they can revoke their informed consent. Another thing that we all adhere to is confidentiality. And so all the professionals that we've discussed today adhere to either HIPAA and or FERPA obligations. So that means that basically we only share information on a need to know basis and as it relates to treatment. For maximizing benefits and doing no harm, really that our ultimate goal for every treatment plan is to achieve the greatest outcomes for that client. And if there are any harms that are associated to treatment, because usually there is some sort of risk, they should not be disproportionate to the benefits of treatment. And really, we should be targeting these goals more globally. So we're not just looking at things which, I love this concept of not just saying that it's mastered from a speech or ABA perspective, but that it's really generalized to the natural environment, meaning in the community or with family or peers. So that's super important in the collaborative model. And then respect for autonomy. So that's helping family members and the client or individual make the most appropriate treatment decisions. And then justice, which is really the treatment of all clients with a sense of urgency and efficacy. So some additional considerations that we should take into consideration when we're really designing and figuring out who's going to be on this treatment team is that those professionals should be knowledgeable and skilled. So knowledgeable and skilled not only in their own profession, but with respect to other disciplines that they are involved with in this team. So that way they can best determine which approach you can use to maximize the development of the child's skills and increase skill acquisition. They should be able to assess and recognize their own strengths, weaknesses, and professional competence. So that means that they should be practicing within their scope of competence. So we all have overlapping scopes of practice. So obviously ABA can address language and some areas of speech, but obviously speech has a much greater domain with that. Also ABA can really address other things like skills of daily living, and so there is that overlapping scope of practice, but really knowing what your area of competence is and recognizing that maybe the occupational therapist has a better strategy than you do and being able to work together. Also, being fully informed in the most current research. So this is within your field, that you are not using outdated practices or models that don't have a lot of research that back them. And that's just, again, to make sure that we're providing excellence in care. In this way, seeking out research, we can also seek out training, consultation, and supervision for things that are outside of our areas of expertise. And really just having a mutual respect for the expertise of each profession. So we all bring different approaches to the team, and each team member can make significant contributions to treatment, which makes it obviously a more comprehensive approach. And we should all be striving to build common ground and shared goals. And then maintaining open communication with professionals and clients. So obviously from the client and family perspective, we should be making sure that our treatment plans are clearly written and stated and communicated to the families, our rationale for any treatment decisions, and really an open dialogue of what's working and not working. And then for the open communication with other professionals, we should really be keeping our collaboration positive, proactive, and goal-oriented, and we should be holding all team members accountable.
According to the World Health Organization's framework on action for interprofessional education and collaborative practice, it should include interprofessional competencies, so where each profession is competent in their area, client and family centered, so the treatment plan is focused on the best needs of the client and takes in consideration for the family, community and process oriented, to make sure that these goals are achievable can be able to be moved into the community. Relationship-based and developmentally appropriate recommendations, so making sure that we work on developmentally appropriate skills, sensitivity to practice differences, and outcome-driven. So how can they work together? First, a comprehensive evaluation must be conducted.
So I'm just going to back up just a second. So this is just a proposed model. So this is working together with all the professionals that we discussed earlier. And this is sort of our ideal model of all these, this whole entire interdisciplinary team. So this is something that I think multiple organizations are exploring, and they may or may not include all of these professionals. So this can be adapted based on which professionals are working in this team. But yes, first a comprehensive evaluation must be conducted, and if there are any diagnoses that need to be made, the psychologists or counselors, the SLPs, or even medical doctors can make that determination.
And then a medical doctor or dietitian can help with any medications or dietary deficits that the client may have.
If there are any problem behaviors, a functional assessment can be given by the BCBA.
An appropriate augmentative and alternative communication device if it is needed. So if the client is unable to verbally communicate, we can look into finding a device or another modality of communication.
So then after all of these determinations have been made, our treatment team can then decide what goals are to be worked on. And the emphasis should be on the psychologists or counselors, the SLP, and the OT.
And then a psychologist or counselor can address comorbid disorders and family therapy. A lot of times family, it's nice for them to go to a counselor to talk about their child's diagnosis. And also a lot of times these diagnoses have a comorbid disorder that goes with them.
And then the behavior analyst can help with behavior reduction if needed, determining what motivators or reinforcers should be used to really determine the best methodology for teaching the skills, and then they can assist with functional communication training, and then measuring the progress of those skills.
And then an example of this could be an SLP helping doing a swallowing evaluation. An OT would be there to help with the eating. A dietitian would be consulted as well. And a BCBA can help with the introduction of new foods. And then the benefit to a collaborative practice is that it prevents unnecessary replication and conflicting treatments. It reduces the cost of care. It promotes high quality, comprehensive service delivery. It increases generalization opportunities, and the client will benefit.
So thank you so much for being here and listening to our presentation. If you guys have any questions or concerns about what we discussed today, please feel free to reach out to us. We'd be happy to collaborate with you and help you with any questions. Thank you.
Thank you.